Hi, I'm Stephen Duckett, Head of the Health Program at Grattan Institute here in Melbourne, Australia. And I want to talk to you about the team that worked on COVID here. I'll do that by sharing my screen. So basically, Grattan Institute is a small independent think tank, public policy think tank. Our work on COVID involved 2 reports in 2020, and we're working on another one right now. We're primarily funded through an endowment, and we took a lead role in advocating for COVID zero in 2020 and continued to do that. And this, of course, our role was prior to vaccines being developed. There's a small team. We did, amongst other things, a whole lot of modelling of the impact of COVID and various policy options. And that was led by Will, but we all are involved in the advocacy and writing work. Australia was unique. Like many other countries, we had a first and second wave in 2020. In mid-July, we were having 500 new cases a day in Victoria, as were many other countries. Our unique response was that we pursued a COVID zero goal. We had very severe 110-day lockdown, and we essentially eliminated it. Unfortunately, there's more COVID circulating in New South Wales at the moment, but nevertheless, the country is essentially mostly in a COVID zero situation. The result is obvious. We've had fewer COVID cases per million people than most other countries, fewer COVID deaths per million people. We're in this Asian Oceania sort of approach compared to the Northern Hemisphere approach. As a result, our economy was much stronger. We had a smaller recession than other countries in 2020. Interestingly, even though we had a long lockdown, our level of restrictions were on average, in terms of days over the period, less than other countries. So Australia had, for example, fewer days of restrictions than the US or Canada, even though we had a much better outcome because we had strong restrictions for a shorter period of time to eliminate, to avoid the yo-yo economy. Our borders were closed, no international travel, Australians couldn't leave the country, even Australians had to apply for permits to travel within the country. So this is my permit for travel from New South Wales into Victoria. So we achieved COVID zero. That's not it. That's not the end. What's going to happen? Our borders can't remain closed forever. So we're now in a situation, the population is very complacent because we've eliminated COVID essentially. And so what do? Our vaccine rollout in Australia has been very slow. It's been very poorly managed. Here is data from Our World in Data, and you can see Australia is at the bottom of the vaccination rollout of all of the developed economies. So we're in a very bad situation in terms of vaccination. But we're still going to have to reopen our borders. We're going to have to move on from where we are. The critical policy question, though, is what level of vaccination do we need to have before we can ease our border controls? We are not in the situation of just throwing the borders open right now without high levels of vaccination. So the public policy question is shifted from whether we do elimination, that decision has been made. The public policy question now, which is the one we're working on and we're advocating about, is what level of vaccination must we have before it is safe to open our borders and to start some of this relaxation. So that's where we are. Thank you very much. It's a good situation to be in, and we'll see how we go. Thank you.